Hi, my name's Dr. Hume Rendle-Short, a GP in Toowoomba. And I'd really like to share with you today a concept that I came across some years ago, and I call it knowledge, understanding and wisdom. And I was actually talking to my registrar about this morning. She came in with a situation where a patient wanted a test for a very unusual and rare eye disorder, and the patient wanted some genetic testing. Apparently the patient's sibling had recently been diagnosed with this eye disorder and it had genetic implications, and the patient said, what about a referral to a geneticist about this? So we Googled it, because I'd never ever heard of this condition. I can't even remember now what the actual name of it was. And to be honest, we didn't talk about the condition. I told her, you can go ahead and read that, and you need to be able to talk intelligently with your patient. But what we talked about is this concept of knowledge, and then understanding, and then wisdom. And I see them as three layers in how we view things. And I said, chances are that where you sit at the moment, this patient, who is a 22-year-old intelligent person, has actually got more knowledge about this condition that you have. They've done their Google search, the diagnosis has been made in the family, they've now come to their doctor requesting genetic testing. You've never heard of this thing before, neither have I, and this patient's got more knowledge about this condition and what it means. And she agreed, she said yes, and she had this threatened look on her face, because as doctors we feel really uncomfortable when patients have got more knowledge than we do on a particular condition. I don't think we need to be threatened by that. I think we need to accept that that's the way of life these days in an internet age. And often that's going to happen. But what this patient doesn't have, unless they happen to be a med student or a physiotherapist or the like, what they don't have is understanding. So knowledge is one thing, to read the books, to say, hey, a genetic opinion might be worthwhile, to even look at percentages. But then you've got to have understanding about that. And understanding is what every health professional, even a medical student, has or gains during their training. Understanding is knowing where all this knowledge fits in, what the words actually mean. And I picked one sentence at random, and it talked about dilated fundal examination and what to look for in that. And I said, look, your patient doesn't understand that one line within the Google search. And your next job is to move the patient from knowledge to understanding, so that they actually understand what the medical lingo means, and they understand how that fits in. The article might talk about drugs, it might talk about other principles of medical, that for you and I as doctors, we understand what all that's about, but we've got to assume that the patient hasn't. So we've got to move the patient from a position of knowledge to a position of understanding. Then I put the challenge to her. And I said, now what you need to do, once you're satisfied that that's happening, is provide wisdom into this situation. So let's continue with this example. The patient presumably will go and see a geneticist, and I haven't got a clue. We didn't even get down to whether this thing's autosomal dominant or just a vague genetic predisposition. But they presumably will come home from the geneticist with a percentage figure. Just like somebody goes with a cancer diagnosis, goes along to the oncologist and comes back with a recommendation that these are your options. This is what you could do, A, B or C. So what does the patient do with that piece of information? And I suggest that that's where wisdom comes into the thing. And I fundamentally believe that as GPs, this is our role. Our role is to impart wisdom, and then to encourage the patient through that process. And I know for myself, when I've had to make some difficult medical decisions, it's not the specialist that I go to talk it through. It's my own personal GP that I go to talk through that particular thing. I think there's a few parts to this thing of wisdom and how we can assist our patients with wisdom. I think it depends on relationship. So you can't discuss a subject and work out, okay, what's the wise thing to do in this situation? Should I have kids or not? in this particular genetic situation, which is what the patient was wondering, should I say, hey, no kids, I'm 22, that's it, I'm not going to have them? That's a big decision. Should I undergo surgery or not for a cancer diagnosis? Should I undergo chemotherapy, alternative therapy, whatever? So for us as GPs to assist the patient through that process of wisdom, we have to have a relationship with that patient. Second principle is that presumably, not always, but presumably that process of imparting wisdom is working towards a decision. And in the examples I've given, yes, it is working towards a decision. And then that raises the final part of the discussion, which I had with my registrar, which says that, hey, okay, the patient comes to a decision, and we've got to, as doctors, as their GP, we've got to trust that process, that we've moved that patient through wisdom to make a decision, even if we don't agree with the actual decision outcome that they might decide. So in the cancer situation, they might decide not to go for chemotherapy, which we think is a no-brainer, yes, you should have it. That's sort of okay, as long as we're comfortable as their doctor, that we have taken them through that process from knowledge, through understanding, through wisdom, to make a good decision. It's all about being a GP. It's all about walking alongside your patients. Thank you.